Well, dire warnings now from doctors across this country about the president's health care law. A survey of hundreds of physicians done by consulting giant Deloitte finds that only about a quarter of doctors believe the health care overhaul will cut costs. Half of the doctors surveyed say access to health care will decrease, and more than two-thirds of those surveyed say the best and the brightest who might consider a career in medicine will now think otherwise. Joining me now for some perspective, Dr. Mark Siegel. He's part of our Fox News Medical A-team, also a professor of medicine at NYU Langone Medical Center. Dr. William Winkenwerder. He's a former emergency room doctor and the former chief operating officer at Blue Cross Blue Shield. And Dr. Scott Berger, a co-founder of Doctors Express and a former ER doc. All right, guys, thank you all so much for being here. So this is fascinating and a little scary. With these doctors, the numbers, two-thirds believe the quality of care is going to go down. 50% say the access to care is going to go down. 70% foresee longer waiting times at emergency rooms. 83% say we're going to see increased wait times for primary care appointments. They don't believe the costs are going to go down. I mean, it's like down the line, every question asked, these doctors were saying it's bad and we're worried. Dr. Siegel, is this politics or real?
Well, I think it's real, and I've been saying for a long time that this is how practicing physicians think. And to see the words, the best and the brightest, exiting medicine, boy, that must be so disturbing to our viewers. And I'm afraid that that's probably the case, and more doctors becoming administrators. No one thought about this when the bill was being put together. You can increase supply. I mean, you can increase demand by giving more and more people insurance cards, but you have to think about supply, and we're already overloaded. Megyn, that's why emergency rooms are going to fill up. That's why primary care visits are not to be had, because if you give more and more people Medicaid, or you insist that everyone has private insurance if the individual mandate holds, where are they going to go? The doctors aren't there. They're not there, and they're not going to be there because medicine is less and less attractive right now.
Now, Dr. Winkenwerder, they also say that 9 out of 10 doctors asked, so this is a pretty healthy majority, believe that insurers are going to raise premiums, not just for employers, but for individuals as well. These doctors do not believe that the American people are going to save money on health care. They think that the premiums are going to go up. As somebody who used to be a Blue Cross Blue Shield guy, what say you?
Right. I say they're right. And premiums have already begun to go up. You know, this administration and this president have been telling us for over a year and a half now that people are going to like this bill. And in spite of that, the public, by overwhelming, over half, have said they don't like it and they'd like to repeal it. Now we have this survey, which is a devastating survey in terms of what it says, because it's coming from doctors. It's coming from people who do understand the healthcare system and who are on the front lines. And I think it's no surprise that they know that this is a 2,400-page bill with dozens, if not hundreds, of regulations, sort of concocted in Washington, mostly a one-size-fits-all approach and solution. And they're saying there's no way this can be good for patients. It's not good for doctors. And the other thing
let me ask Dr. Berger, because I want to get him in on this as a former ER doc.
Sure.
They say that 70% of the doctors believe we're going to see longer wait times plaguing emergency rooms. Now, I thought one of the purposes behind this bill was to sort of help alleviate what we're seeing in emergency rooms, which get treated like general practice visits by folks who don't have insurance.
Well, I'm glad you asked me that question, because I was a practicing emergency room physician. I saw very long wait times up in New York City. I think we have to come up with creative and novel solutions, and we've done that with my company, Doctors Express, which is a series of urgent care centers which provide walk-in medical care services across the country.
Do you have to have insurance?
No, you do not have to have insurance to be seen. Just as an example, yesterday at our centers we saw over 1,500 patients the day after Christmas. So we don't want patients clogging up the emergency room. We want to give them an affordable option, because the primary care doctors are going to have more patients on their rosters who they need to manage their chronic disease states. Look, you're not going to be able to go to your doctor or have them come to your house or see them for a cough or cold. You need to have a viable alternative to that, and that's what urgent care provides. So I think getting more people insurance so they're not flooding the emergency room because they don't have any resources to pay for care, and the emergency room can't force people away is a good thing.
Dr. Siegel, I want to get you to weigh in on that, but I also want to ask you about the doctor shortage, which is something that is really alarming. I mean, they're talking about now that in 2019, the American Academy of Family Physicians warns that the U.S. is going to be short 40,000 doctors. They say that we already face a shortage of primary care docs, which is what you do, Dr. Siegel. Medical schools produce 1 physician for every 2 our country needs. How does the president's health care law discourage doctors from getting into medicine?
Well, Megyn, it's actually the Association of American Medical Colleges says it's going to be 160,000 doctors short by 2020, and they are discouraging doctors because they're busy cutting our fees. I mean, look, we've been talking on your program before. We're still facing a 27% cut.
But they're going to give you more patients.
Well, we don't need more patients. We're already full. And by the way, what Dr. Berger said about the emergency room, just to address that, they're already full. They've cut down emergency rooms by 10%. And you give Medicaid to a person, they're more likely to use the ER unnecessarily. So insurance is not the solution. It's part of the problem. And expanding insurance expands the problem.
You know, Dr. Winkenwerder, I want to ask you, because I have a